Welcome back. MetroPlusHealth, New York City's affordable health plan, released a series of national surveys that uncover vital insights into mental health within the Hispanic community while looking at social media usage and parenting trends across the United States. Director of Behavioral Health for MetroPlusHealth, Jan Popescu, joined me to discuss the findings. Jan, thank you so much for joining me.
Thank you so much for having me. Good morning.
Now, can you give us a brief overview of MetroPlus Health findings on mental health, specifically in relation to the Hispanic community, as well as findings on parenting and social media?
Right, so I'll give you a couple of key points from our survey. And some of these findings, really confirm, what we, as clinicians and professionals working in the field of behavioral health, kind of knew all along. 81% of people of, Hispanic descent, they believe, that it's important for them to have access to culturally competent services. We're also finding out that 60% of those who took the survey know someone or themselves, being in need of accessing behavioral health services. What was also very interesting is that a good percentage of 21% of those interviewed, also stated that they do support someone else outside of their family to, as far as access to health care. I think that was really key and confirmed, that for us as a plan that offers affordable care to people in the community is important, to make sure that our network of providers, are culturally competent and they have, prompt response, when someone is seeking help.
Now, with that, what barriers do Hispanic Americans face when trying to access mental health resources?
Well, I think, and I'll actually have a little bit of a story that I'm going to give you. But one of the major barriers there is a sense of, a culture difference. And that includes language, that includes the socioeconomical aspects. So the story that I want to give you to make a good example of that, on Friday, we had someone who visited us at our headquarters at 50 Water Street, a member who is receiving essential plan coverage, from us. And this member, Spanish speaking only, working, and really needing to have access to seeing a therapist in person. And this person has been looking for getting an appointment, for a very long time. And unfortunately, kind of being put on hold, making phone calls, and not getting to speak to a live person, and became extremely frustrated, like any of us would, and just decided to walk into our, headquarters, to really get some help. And our customer service, just a wonderful team, this big, many languages, were able to meet with a person, they connected him to us, to one of our clinicians, and we talked to him, we're able to put his worries at ease, and connected him to a service in Queens, in Rego Park, which is close to where he lives, and able to get him an appointment within a week.
Wow, that's amazing.
In person with a Spanish-speaking clinician. So I think that for us, the value of being able to access a network of providers who are diverse and recognizing the needs of our Hispanic American population is really important. It's at the forefront of our mission.
Now, when we talk about mental health, I think in this day and age, it's important to bring up social media because it has an impact on mental health. Can you just tell us a little bit more about what you found in regards to social media and mental health?
Yeah, well, pretty concerning findings. And once again, I think, that I'm a psychotherapist by training, and I did a lot of my practice in community clinics for many years. And I treated a variety of different ages, from the youngest to more into the senior population. And we recognize that particularly with the younger population, there is a context, issue. And, thinking of the Gen Z population, the young people, who were born in the late 90s, 2000s, they were born in this context where technology really meant everything. So for that reason, we're seeing, that one in four people who actually answered, the survey identify an addiction issue when it comes to how much time they actually spend on using technology. So when we talk about addiction, we're talking about physiological symptoms that a person would experience being not having access, to technology. So like I think, we identify the fact, that there's a need, to respond to this without being judgmental, right? Kind of comparing, to the previous generations that look, you should not, be spending so much time on, on that phone. Well, the bottom line is that that's all they know, and they grew up, using that. So I think, for us being able to offer at MetroPlus access to care where, telehealth, is a means, to get help, right? So someone experiencing, let's say, like anxiety and depression and fatigue and insomnia, all of this related to spending too much time using that, social media. It means, that we need to be able to use our network of providers, to really welcome, a conversation about that.
Now, what strategies can parents implement to manage social media usage? As we know that many young people
Yeah.
have reported having negative feelings after using it.
Right. Well, I'm a parent myself, so I'm just going to give you a little bit of a story, of what has happened to me. My daughter is 11, and she's a bright student. She really enjoys a lot of different things, However, as her generation, and as the way that they receive information, they educate themselves. They tend to spend a lot of the time searching for that information online. And I noticed symptoms, right? I noticed that she was not as available to doing things with us, with the parents. She was not as excited about things that were other than watching a movie or looking at shorts on the phone. And so it just became a point of kind of rediscovering ourselves as parents. First of all, what type of behavior do you actually model, right? So what do you do? What do you project as a parent, to a child? So if you as a parent, I mean, you see our research, also shows our survey that, 46% of the parents who answer the survey spend 6 or more hours on the phone browsing, through social media daily. So what that tells you is that, after a regular work day, you come home and that's what you do. That's how you spend your day, your evening, instead of spending time with your child. So, making changes there, it's absolutely important. Projecting, important and healthy behaviors. That read a book, watch a movie together, or spend time with your child if they have an interest in discussing something that they saw on social media. Why don't you just talk about it? Show some curiosity and not necessarily, dismiss it because it's a bad thing to do. Getting outside more. I think, we're learning a big lesson about, connectedness to the outer world, to the nature, to the rivers, to the trees, to the woods. And that speaks to a larger concept of how do we appreciate what we have. Okay, so if you want to put it in the larger context of climate change, taking care of nature and taking care of ourselves, by doing that. And so a lot more proactive, planning, I would say, parents being mindful that if they don't intervene and provide opportunities for their children and provide, positive role models, then the children won't know which way to go.
Right. Well, I want to say that I think that us having this conversation is so important because right now we're talking about Gen Z, but you mentioned that you have an 11-year-old, which I think maybe Gen Alpha.
Probably, yeah.
And so I think that it's important that we're talking about this now so that the next generation
Sure.
doesn't have the same, attachment to social media. And so, with that, I want to thank you so much for joining us and having this conversation. And hopefully we can kind of make these changes because, as you mentioned, we're seeing that it is having a negative impact on adults and children.
Sure.
And so I'm looking forward to, continue this conversation with you, maybe in a few months to see if things have changed. But, once again, I want to say thank you so much for joining us and talking about this.
Thank you.
To learn more about MetroPlusHealth, visit their website at metroplus.org. Stay tuned. We have more for you right after this.